Hello, everyone, and welcome to The Ohio State University's Combined Emergency and Internal Medicine Residency Program. I'm Chief Resident Matthew Wilson, and I'm here today with my Co-Chief Resident.
Hi, I'm John Hendricks, and we'd like to introduce to you guys our co-residents, Dr. Zach Smith and Farha Khan. You're going to be our tour guides today, take you and show you some of our favorite spaces and places here at The Ohio State University Wexner Medical Center.
We're so excited that you're interested in our program. We hope you enjoy the tour, and we hope you get the chance to meet you soon. Guys, should we get started?
Yeah, let's go.
The Ohio State University Wexner Medical Center is one of the largest academic centers in the country with over 1,400 inpatient beds.
We also have 4 specialized towers here at The Ohio State University, including the James Comprehensive Cancer Center, the Ross Heart Hospital, our Dodd Rehabilitation Facility, and behind us, the Harding Psychiatric Facility.
That's right, Farha. We also have a brand new inpatient tower opening in 2026, as well as our Ohio State University East Hospital and multiple freestanding urgent cares and outpatient care facilities. Welcome to the 7th floor of Pryor Health Sciences Library, which houses the Department of Emergency Medicine offices. There's 2 very important people here that we'd like you to meet.
I'd like to introduce you to our program director and our program manager.
Hello. Welcome to the Ohio State University Emergency Medicine and Internal Medicine Residency Program. I'm Jenna Morgan. I'm your program director, and we have Janine Hatfield, our program manager. Here at The Ohio State University, we are more than a training program. We are a place where residents thrive personally, professionally, and academically. And we do that in a few ways. First, we have very strong clinical training settings. Second, we have superior academic resources. And finally, and I feel like this is the hallmark, we have close-knit mentorship. If you feel like OSU is a place for you, come check us out.
Next, we'll head down to the 6th floor of the Pryor Health Sciences Library to show off our didactics area and our simulation center.
Welcome to the 6th floor of Pryor, to our large seminar room where our emergency medicine didactics take place. These are 5.5-hour protected sessions every single week.
Our didactics are resident-led and faculty-supported and typically include both structured lecture time as well as innovative simulation time, which is where we'd like to take you next. Welcome to our Innovative Simulation Center, where we practice a variety of cases in our 4 separate sim bays.
Now we'd like to show you some clinical spaces. We're here in our spacious ICU workroom with our previous EM-IM graduate and current Palm Crit Fellow, Matt Barraza.
Yeah, here OSU is great. We have tons of opportunities for fellowships in both emergency medicine and internal medicine here. A lot of us choose to stay because we really like it here, but OSU will make you competitive for wherever you want to go. Importantly though, beyond just having a spacious workroom, you have a workroom with an awesome view like this.
Welcome to one of our 3 trauma bays. Here at Ohio State University, we're a level 1 trauma center, a comprehensive stroke center, and a comprehensive burn center with over 120,000 visits per year.
We're lucky to have access to advanced resuscitative equipment, as well as advanced airway support, including fiber optics for all of our traumas.
Our emergency department is divided up into a couple of different zones, including the west side and the central side. You're currently here with me in the west doc box.
We're now here in an internal medicine workroom with Dr. John Hendricks, one of our current 5th-year EM-IM residents and chief resident of our program.
Hey everybody, thanks for your interest in our program. We're sitting here in one of the workrooms in our James Cancer Hospital, which is one of the many hospital sites that you'd be working at if you came here for residency at The Ohio State University. One of the benefits of our institution is that you have such a wide variety of clinical experiences, especially on the inpatient services. All of these are resident-led, and they cover a wide spectrum of clinical specialties. The James Hospital has a ton of different cancer services through hematology and oncology, brand new rapid diagnostic services for patients who come in with undiagnosed masses. Many of our patients are on clinical trials, and that's excellent clinical exposure that I don't think you'd really get anywhere else. We have another hospital, the Ross Heart Hospital, that has patients with lung transplants, heart transplants, advanced cardiac life support, including ECMO. Our university hospital has a variety of other general medicine services covering a variety of other clinical conditions.
Thanks for that great overview of internal medicine here at Ohio State, John. Now let's talk more about what it means to be a resident and life in Columbus. There's so much to do in Columbus. We have multiple sports venues, including professional teams like the Columbus Crew and the Columbus Blue Jackets, as well as, of course, the Ohio State Buckeyes. We also have multiple cultural opportunities, including the Columbus Zoo, as well as art museums and science museums. And if you're into music, we have both large and small venues as well.
The surprising thing about Columbus is that all of it's affordable. In fact, 50% of our residents own their own homes.
Columbus also has an amazing food scene with tons of restaurants, breweries, distilleries, and food trucks.
And speaking of food, let's show you some of the options here on campus.
We're here on the 14th floor of our outdoor cafe, which serves breakfast and lunch daily with the world's best pancakes. We also have Wendy's and Panera in the building, and our cafeteria has a rotating selection of local vendors that changes daily.
In terms of other food options, our resident lounges stock free food every day, and we also get food at all of our lunch conferences for both EM and IM.
Ohio State has many wellness initiatives, including this 24/7 gym and lounge that residents can use between shifts. The emergency department also has a wellness grant for resident-led initiatives both in and outside the hospital.
One of the most important things about the Ohio State University to me personally is its commitment to the safety of its residents.
Yeah.
We have a variety of options here to ensure that residents get home safe and that they're in a place where they feel cared for. For example, after shift, if you want a security escort to your car, those are available 24/7. If you're too tired to go home after shift and you would like to take a Lyft or an Uber, our program will actually pay you back for the cost of that Lyft and Uber. Additionally, as we come up on one of our rooms here, we have a safe space to sleep or work after your shift ends so that you can leave here refreshed. Hey, John.
Oh, hey, Farha.
You working on our schedules?
Yeah, actually. I love to come here after a busy shift to get some work done. Find a nice, quiet place to relax.
Hey guys, Matt and John again. Welcome to the last stop of our tour. It's the internal medicine resident workroom.
This is where our night float teams come and spend their evenings admitting patients. It's also a room for residents during the day to come and finish their notes and see consults.
This is the last stop of our tour. We hope you guys enjoyed it. To learn more about our program, check out our website or follow us on Instagram, and we hope to hear from you soon.